Today, I'm reacting to an NXT injury. The Ridge Holland Injury.
Bro, what are you talking about, man?
Today, I'm talking about an event that occurred on October 8th, 2020 during an NXT match involving Ridge Holland and Danny Burch. Although Ridge is an upcoming star in NXT wrestling, his rise to stardom will have to wait after things took a turn for the worse for him during this incident. Although he was victorious in the match, sometimes victory can be bittersweet. In this video, I'm going to look more closely into what happened to Ridge Holland in this match and why this victory was overshadowed by the events that occurred after the match.
Ladies and gentlemen, can I please have your attention?
Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. If you want to learn who I am and why you should subscribe to my channel, then stick around to the end of the video. Otherwise, let's get right to it. So today, I'm reacting to the recent news of an injury that Ridge Holland suffered on October 8th, 2020. The injury occurred at the end of the live aired NXT match when a brawl broke out between Ridge and Burch supporter Onnie Lorcan. Ridge was standing outside of the ring when Lorcan launched a leaping attack from inside the ring, over the top rope, onto Ridge down below, with unexpected results. Lorcan landed on Ridge, who immediately fell awkwardly backward with his left leg buckling underneath both men. As his leg bent at an unnatural angle, Ridge screamed out in pain and a referee immediately threw up the crossed arm sign. Several referees and the medical first responders worked on Ridge while he lay on the ground. His left leg was splinted and eventually he was placed onto a stretcher and transported to the hospital. TMZ Sports reported that Holland underwent surgery on his injuries shortly after his arrival in the hospital. So, how was Holland injured? What structures did he injure? How were these injuries treated? And what's next for the up-and-coming WWE superstar? The video from ringside shows that Ridge stumbles slightly with his left leg when attempting to catch Lorcan as he flies out of the ring. Consequently, his left leg is out of position with his left foot slightly behind his right, and his left leg externally rotated or turned out from his body by a small degree. As Holland begins to fall backwards, his left foot becomes trapped in this position. The problem is, both the knee and the ankle are hinge joints with basically a single plane of movement. As Holland falls backwards, this plane of movement has now become different through rotation from the plane in which he is falling. And when this happens, as Russell Peters says,
somebody gonna get hurt real bad.
Real bad. If we look closely at the video, we can see potential injuries at both the knee and the ankle levels. As the leg is externally rotated when the knee is forced into flexion, we can see that the knee is subjected to a rotational valgus, where the inside of the knee opens up as the outside of the knee is pinched together and rotated away from the midline. We can expect the combination of external rotation and valgus to lead to injuries at the level of the knee. However, the awkward positioning leads to problems at the ankle level as well. There you can see that the foot becomes trapped against the ground in a plantar flexed or toes pointed downward position. As Holland falls backwards with the leg externally rotated, the plantar flexed ankle is externally rotated and pronated on the tibia, leaving the ankle susceptible to injury as well. So basically speaking, forcing rotation through a hinge joint is not good and leads to nothing but bad outcomes. Like oil and water, rotation and hinge joints do not mix. At the level of the knee, injuries that we could expect to see would include a patellar dislocation or dislocation of the kneecap, injuries to the patellar tendon, the quadricep tendon, or both, injuries to the cruciate ligaments, the collateral ligaments, or both, injury to the medial patellofemoral ligament, and even fractures of the patella, the femoral condyles, or the tibial plateau. At the level of the ankle, an external rotation pronation mechanism of injury could be associated with injuries such as an oblique fibula fracture, a distal tibia fracture, an ankle dislocation, or an injury to the syndesmosis or the tissue between the tibia and the fibula. An update on TMZ stated that Holland suffered a fracture dislocation of his left ankle, as well as a patellar dislocation and subsequent patellar tendon rupture of his left knee. This means that his left ankle was fractured and unstable, which allowed it to move out of position and become dislocated. In addition, as his kneecap moved out of joint, The stress on his patellar tendon became too much, eventually causing his patellar tendon to rupture. Either one of these injuries would have been a problem on its own. Together, however, these injuries represent a significant impediment to Holland's progress in the WWE. Holland underwent emergency surgery shortly after admission to the hospital on October 8th. This was necessary because dislocations typically require operative management within 6 hours to prevent injury to the cartilage of the joints, skin necrosis or ulcers, necrosis or death of muscle or nerve tissue, unnecessary soft tissue swelling, and further damage to the bones involved in the fracture. Each of the injuries that he suffered would require operative management except for the patellar dislocation, which usually does not require immediate surgery once the patella has reduced back into the joint. Given the fact that Holland suffered both a patellar dislocation and a patellar tendon rupture, there would be little concern of an irreducible dislocation since the patella would be free to move just about freaking anywhere. Expected surgeries for Holland would include an open reduction and internal fixation of the ankle fracture dislocation. This would be performed first as a result of the concern for the cartilage of the ankle joint. The procedure would involve the operative fixation of both sides of the ankle, usually with a plate and screws on the fibula and screws on the medial side of the ankle. Once completed, the surgical team would proceed to repair of the patellar tendon with the patella in a reduced position. The technique used for repair of the patellar tendon will vary depending on the level where the tendon is ruptured. If the tendon is avulsed or pulled off either the tibia or the distal patella itself, then the tendon will be reattached with suture anchors inserted into the bone. However, if the tendon is torn mid-substance away from either bone, then the repair will also require suture repair that bridges the tendon rupture in addition to the suture anchors themselves at either end. Both the knee and the ankle will require immobilization after surgery for a period of approximately 6 to 8 weeks. After both the ankle fracture and the patellar tendon have healed, the period of intense physical therapy will begin. Holland will be incredibly stiff after this period of immobilization. We can expect him to regain his range of motion in his knee and ankle over another 6 to 8 week time period. Once back to normal, he will begin strength training to restore strength lost after his injury. It will likely be several months before this too is restored. Overall, if all goes according to plan and there are no unforeseen complications, we can expect that Holland's recovery will take approximately 6 months. If all goes according to plans, he will be able to start training for his return to the NXT ring after that time. However, it could be anywhere from 8 to 12 months before we actually see him competing again. Here's to hoping it all goes well. If you are here because you recently subscribed to my channel, then thank you for becoming a part of the Intern Army, now approaching 60,000 supportive members. Welcome to my channel where I explain orthopedic injuries and sports medicine in a way that's easy to understand for everybody. If you're interested in sports injuries and how they happen, then yo, I got you. So subscribe and hit the notification bell so that you don't miss any of my content. Follow me on Instagram or Twitter for medical stories and content, TikTok for info on medical education, and on my other YouTube channels for my podcast or for workouts and training tips. And of course, Intern Army OGs know that bones are great in compression, but they suck in rotation. Thanks for watching, and as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.